Hello everyone, I'm your host Mariana and you're listening to A Degree Farther, the official podcast of the graduate school at Hood College, where we feature current students, alumni and faculty who are innovators on our campus and in our community. If you're passionate about health, technology, or both, this episode is for you. We are happy to introduce Dr. Timothy Coffin. Dr. Timothy Coffin is the director of the new Health Informatics program. He is also the founder and chief executive officer of Celtic LLC, a consulting firm specializing in government healthcare solutions. His educational journey boasts a Bachelor of Science in Engineering from the U.S. Air Force Academy, a Master of Public Administration from the University of Dayton, and a PhD in Health Research Science from George Mason University, complemented by various certifications related to the health informatics field. With a profound understanding of health research science, particularly in the realms of knowledge discovery and health informatics, Dr. Coffin has been a trusted advisor to numerous federal entities. His expertise spans healthcare, technology innovation, national security, and counterterrorism measures. Dr. Coffin's dedication to research is evident in his academic endeavors, which include modeling depression, precision medicine, and suicide risk detection within the veteran community. Moreover, he's at the forefront of AI-based methodologies aimed at identifying rare diseases and combating opioid addiction. Today, we dive deep into the world of health informatics with Dr. Coffin, the visionary behind the new program in this file at Hood. This episode is brimming with invaluable insights and cutting-edge technology that will undoubtedly pique your interest. Dr. Coffin's personal journey is equally inspiring, making this conversation a must-listen for those aspiring to make a difference in healthcare or excel in the realm of IT. Before we begin, be sure to hit that follow button and turn on the notifications so you don't miss out on our upcoming episodes. Now, let's jump into this enlightening discussion. Enjoy it! Hi, Dr. Tim Coffin. Thank you so much for being in A Degree Farther. We are very excited to have you today.
Thank you. Thank you for the invite.
Okay, so let's start talking about you. If you can share us about your professional background and what brings you to Hood College, sorry.
Sure, absolutely. So I'm as you said, I'm Dr. Timothy Coffin. I'm passionate about the intersection of healthcare, data, and technology. I call McLean, Virginia, my home, but my work is taking me all around the world. Kind of a snapshot of who I am. I've spent over 3 decades in healthcare and technology space, working with some of the biggest names in the industry, like IBM, Leidos. I've also worked for federal health agencies like HHS and VA and DoD. My journey has been all about making a positive impact in healthcare, data mining, machine learning, and artificial intelligence. I got a PhD in health research sciences with a concentration in knowledge discovery and health informatics, which has been instrumental in my career lately. I'm also a diplomat of the American Medical Informatics Association, where I'm a board-certified AMIA certified informatics professional. I'm not always about theory. I'm also a hands-on person. I've been involved in identifying and defining requirements and implementing technology solutions for large government organizations and private organizations. I'm all about driving the development and execution of artificial intelligence tools and concepts to deliver real business value. I've also been a trusted advisor and thought leader for a lot of government decision makers. I would say my core competencies include artificial intelligence, machine learning, data operations, architecture, and agile engineering. I'm proficient in some languages like R and Python and Stata and SQL. I've also got a knack for problem solving. I hold certifications as a Lean Six Sigma Master Black Belt. I'm also a project management professional. Currently, in addition to working at Hood, I'm the CEO, president, and founder of my consulting company called Celtic LLC, where I focus in healthcare policy, advocacy, data mining, machine learning for federal agencies and some private companies. I also worked as the director of artificial intelligence and informatics for a company that supported NIH. In my various roles, I've had some exciting experiences, like the opportunity to develop AI models to predict rare diseases, identify opioid addiction, determine the optimal prescriptions for depression. I've even helped done some work with suicide risk among the veteran population. I've also used AI to streamline medical review processes, significantly reducing processes time. In my journey, it's not always been about me. I've also kind of dipped my toes in academia, obviously. I've served as an adjunct professor for health informatics at George Mason University, College of Public Health, and currently I'm the visiting professor at Hood College and the program director for the bioinformatics and the health informatics program at Hood. I'm really passionate about sharing my knowledge. I've taught courses, as I said, in AI, machine learning, database use, health administration, health policy, and health informatics. I'm a published author and contributing author for a textbook on big data and electronic health records. I'm also involved in the certification development committee for the HIP certification at EMEA. I've led organizations through transformation, in leadership roles like in iGate Government Solutions. I've built a company to about a $350 million level, which was an international IT services company where I shifted the focus toward healthcare analytics and worked with the healthcare payment industry. I'm also proud to say I served in the military, where I served in various roles, including conducting flight tests on several new aircraft. I did R&D in government labs, program management and acquisition, and I was also in international programs. So that's kind of about me. I have a wife and 4 kids. I love to play hockey.
Okay, you do all of that and you have a wife and 4 kids. Okay.
Yes.
Good.
They keep me busy.
Yeah, I bet. Well, today we would like to focus on the new health informatics program that you are directing at Hood College. So if you can tell us a little bit about what is it, how did it come out, and what are the news about this health program?
So the health informatics profession I consider to be the Rosetta Stone of the healthcare profession. Health informatics is a specialized field within the healthcare industry that combines communication, information, and healthcare with the goal of improving patient care. So health informatics professionals use resources like health information systems to collect, store, retrieve, analyze, and utilize healthcare information for a variety of purposes. The field involves helping increase collaboration and coordination between the healthcare providers, streamlining medical quality assurance processes, improving cost efficiency for delivery, increasing accuracy, and really making the healthcare delivery process better for the patient. Graduates in this program, the health informatics program, really have excellent hiring potential and earning potential, or the average median salary for a health informatics professional across the U.S. is about $105,000. Health informatics is really instrumental in improving patient outcomes and offers a lot of career paths that support the healthcare industry. When you graduate with this degree, students will have learned a variety of roles such as automating clinical care, building operational data systems, and training healthcare workers to use computer systems. Our program is a new program, and we'll start taking students in January of 24. We expect our first large cohort of students to begin in August of 2024. This program began really as an idea in the graduate studies department. April Bolton, she contacted me and asked me to help the college decide if developing this program, a certificate program and a master's degree program, was feasible and made sense. So after about a year of research and market study, it was decided that Maryland had a need for Hood College, or that Hood College could fulfill. And under April Bolton's leadership, we developed a proposal for a new program based on the Commission for the Accreditation of Health Informatics and Information Management Education Standards. And then we sought and received approval from the Board of Trustees. And from there, once we got approval, we started building out the curriculum and preparing the ramp for students to come in.
Okay. And who can apply for this program? Like what type of careers can apply for this program, and how the process of applying works? And when they apply and they get in, what the students can expect from this program? What is the format and the structure that the program have?
Okay, so we're kind of looking for information technology, people with information technology or healthcare background. That's what we'd like to see, but it's not really required, but it is a plus in admission. Students with the relevant information technology or healthcare background are encouraged to apply, but this is also good for students who are planning career changes. So, if you come from other backgrounds, it's a good way to get into healthcare because your knowledge of IT or your knowledge of healthcare can be combined with, and this is a relatively new field. So, it'd be important for students to describe in the admissions process why they're looking at this type of career change. So the Masters of Health Informatics program at Hood is designed to provide students with a lot of knowledge and skills to work in the healthcare environment. It's a 30-credit master's degree program with a 3 credits capstone project. All the classes are going to be taught in the evening or online by experts in the field. Who's going to interact personally with the students, and it's kind of targeted to be completed within 2 years. The degree includes some required gateway foundational courses. The foundation courses represent background knowledge and skills that will be necessary to complete the degree program. The courses can be waived if you have a background in IT, but students holding a bachelor's degree in computer science normally won't have to take these foundational courses if they receive the appropriate grade. Once these are completed, the program itself is divided into three core parts. There's the core courses, the electives, and the capstone project. The core courses include topics like healthcare data management, statistics, healthcare information systems, and data analytics. And the students can choose from a variety of electives to include things like bioinformatics or artificial intelligence or machine learning as it's applied to health. And then the capstone project is the culminating experience that allows students to apply their knowledge and skills that they've learned throughout the program in the real world. So students will work with their faculty advisor to identify a research question or problem. We'll work with them to conduct research and then present their findings in a written report or an oral presentation. So you'll apply for the program, and based on the application, we'll determine if you meet the requirements. And do you want to know what the requirements for the actual program are? Is that something that would be interesting?
Yeah, that would be great if you can mention them.
Okay, so the requirements are either a bachelor's of arts or a bachelor's of science in something like life science, health science, computer science, or information technology with a GPA of 2.75 or higher. Those are the preferred backgrounds, but we will look at people from other backgrounds. For instance, the psychology background will obviously be acceptable. Even a business background will be acceptable because there are ways of applying that knowledge and skill set to this area. If you don't have that, if you have a health informatics certificate from Hood College, the certificate program, you've completed that with a 3.0 or higher, you can get into the master's program. Or if you've completed another master's degree in health, computer science, or IT with a GPA of 3.0 or higher, then you'll meet the requirements. There's also a personal statement of intent, which is a short statement about 250 words about how learning health informatics will help you achieve your future goals and what they are. And then we have one or two essay. We have one essay questions with 2 options. It's about a 600-word essay. So, it's a pretty simple process. We don't require anything like a GRE or a GMAT. for the program. So it's just based on your experience and your previous education.
Yeah, and people can start applying since January.
They can start applying immediately. They can apply now, and the classes will start in January.
Oh, okay. Okay. Perfect. Okay, I think you already mentioned a little bit about the opportunities that people could have if they assist to this program. But can you tell us a little bit more about like what this program can provide to the graduate students after
Well,
it?
yeah, I'm sorry. So career opportunities for the program are pretty extensive. The field of health informatics is really a dynamic and continuing evolving area. It's actually a new discipline. It offers a variety of opportunities for professionals within the healthcare and information technology environments. And really, it's an opportunity for the graduate to choose what role they want based on their interests, skills, and career goals. But graduates of health informatics usually prefer, like I said, a wide range of opportunities. A lot of them end up in executive positions, positions like the CEO or chief information medical officer of a hospital. You know, with the rise of electronic health records, there's really a push towards data-driven decision making, and health informaticists really understand this. There's also health informatics analysts, which are people that use electronic health records to do an abundance of data analysis. There's project managers, managers of healthcare databases that are to build new systems within hospitals. Graduates can become software engineers or developers, which are higher paying computer jobs in healthcare. They can become implementation consultants, where they'll come in and advise hospitals on project-based work, as in maybe how to implement new computer systems. Some of the common people that pursue this degree are doctors and physicians who hope to, get out of the doctoral into executive positions. So a lot of doctors join health informatics programs because they want to get into management. So, a physician can become qualified to become a chief medical information officer. There's also opportunities like health informatics specialists, clinical informaticists, health data analysts, project managers, clinical system administrators, healthcare consultants, telemedicine specialists, privacy officers. You can also do research, academics. So there's a lot of opportunities with this degree. It's not just one career path.
Okay. And what are your hopes for this new program?
Well, I hope the program grows, but the program and faculty become a source of health informatics professionals for the DMV area, as well as internationally, because this degree tends to have a big focus from international students. In my past, I've had classes, students from India, from Saudi, from Korea, from Japan, all over the world, because obviously health systems and health professions are big everywhere. So additionally, I would like to grow an effective research program so we can provide opportunities for students to get hands-on practical experience with some of the organizations around, like the CDC and NIH and some of the military facilities around here. So that's what I hope.
Okay, and well, now that this new program is coming, and I hope a lot of people is listening to us and getting very motivated. Do you have any words of wisdom or motivation words to people that is interested but maybe doesn't know a lot about it, or are curious and are not sure about taking this path?
I myself got a degree in health informatics as a career change. I was, a military intelligence person, and I utilized the skills I used for doing, anti-terrorism work to apply to the healthcare field. So it is a good opportunity to make a career transition. And this is a new field with plenty of opportunities. So I encourage everyone that's looking for additional education to consider the Masters of Health Informatics at Hood College. And if you want more information, you can actually go to the website at https www.hood.edu/graduate/program/health-informatics-ms. Or you can contact our really excellent Assistant Director of Graduate Admissions, Vanessa Solis. That's Solis at hood.edu, and that's spelled SOLIS at hood.edu. So she is an excellent resource for getting questions and answers about the program. And I'd like to thank you for having me on your podcast today.
Thank you for being here. And yeah, we can also share this information in the description of the episode. And also I was gonna ask you if we could maybe share your book and any other resource that you want to share about all the amazing things that you mentioned that you did in your background career.
Okay. Mm-hmm. Do you have any other questions for me today?
Yeah, I have a last question. I would like to ask you, after you change your career path and you now decide to do this health informatics, what do you think is the best thing or the best project that you did so far?
Well, how I got into this is I supported a group called the Defense Science Board for TBI and PTSD. And I started taking data from all the soldiers that got injured in the war. And instead of looking at each one individually, I built an aggregate model of all the injuries on a single body. And what I started to do was take those injuries and analyze them by what specific job they were doing in the military. So I was able to show that, truck drivers would get injured in a certain place, like the left side of their body if they were driving, or the right side if they were riding. Helicopter pilots would get shot from underneath in the rear end. Infantry guys would get shot in the left shoulder because they were holding a weapon facing forward. So I was able to show that they could develop armor to protect the soldiers based on the type of, what I call mission-specific body armor. So that was a unique thing. I also developed a website with some contemporaries of mine. It was a project called Me Again Meds, which a person could go in and put their demographic information, in other words, what they were, who they were, and what their symptoms were. And this was taking a look at depression. So most depression medicines, like 30% of most depression medicines have like a 30% success rate. So the way things are practiced is, you'll go in, you say, I'm depressed, and the doctor will give you a prescription, see how it works for 6 months. If that one doesn't work, they'll try the next one. And what we were trying to do is circumvent that process, where we could take all this information and built an artificial intelligence model to predict what the best medication for them would be for their situation. And that would be, their demographics, what type of thing why they're depressed. So there's a lot of reasons. So we were able to, reduce the amount of time patients had to spend before they got the correct medication.
Well, I'm sure that all what you're sharing with us is coming up for a lot of people that is listening, and I hope they are getting motivated, because the impact that you're doing to the health in this moment is huge. So thank you for sharing your experience, for sharing all this information, and I wish you a lot of good luck with this new program.
Well, thank you, Mariana. You have a great day.
You too. Thank you so much for listening to A Degree Further, the official podcast of the graduate school at Hood College, where we help you go farther in your life, in your career, and in your community. Be sure to tune in next time and to catch up on all the latest episodes. Visit hood.edu/a degree further. I'm your host, Mariana, and thank you so much for listening.